Good morning to all of you. So today we have come finally to the last part of hernia in children. In previous two classes we have already studied what are the different types of hernia, what is their pathophysiology, and what are the signs and symptoms, how to manage all these things we have already completed. Now in the last part we are going to study the nursing care. Okay, so what I have done is, sorry. What I've done is I've used a care plan for inguinal hernia. Okay, this is a care plan for inguinal hernia, but you can use it for other hernias as well. Okay, so I've used four basic problems, and based on that I've done it. First is acute pain. Okay, so what is acute pain? It is an unpleasant sensory and emotional experience arising from actual or potential tissue damage, or described in terms of such damage may be slow or sudden onset of any intensity from mild to severe, with anticipated or a predictable end and a duration of less than 6 months. Okay, so in inguinal hernia what happens is, what is pain? It is an unpleasant sensory and emotional experience. So there may be actual tissue damage or there may be a potential tissue damage. Okay, next is the pain may be mild or severe. We have already studied that in inguinal hernia pain will be there. It may be mild or severe depending on whether any intestine is twisted, or is it inflamed, or is it edematous, what is the size of hernia, all these factors included. Depending on all these factors, the type of pain may be mild or may be very severe. Okay, and with an anticipated or a predictable end. We have already studied that if it is a case of inguinal hernia, you cannot continue for more than 6 months. Management all will depend on the signs and symptoms, the size, and the surgical repair is the only answer for it. Okay, so it is usually, the duration will be usually less than 6 months. Okay, and this pain also may be due to surgical repair. Okay, so pain can be even before surgery depending on the type of hernia it is, or acute pain can also be related to a surgical repair. Okay, now what are the signs and symptoms? How do you, it is possibly evidenced by maybe a change in facial expression of the child. All of you have worked in pediatric ward or maybe a surgical ward where if you have come across children in C1 ward, we have 8 beds of surgery. If you are posted, whenever you are posted, if you had any patients with surgery, then I think you will be able to understand this better. So whenever any person has pain, including the child, there will be change in facial expression. Okay, the child will be irritable, or if the child is can talk, the child will tell that I am having pain. There will be guarding behavior. What is guarding behavior? The child will not allow you to touch that area. Okay, so that is called as guarding behavior. Then as the child will be crying, maybe moaning, and the child will refuse to move. So these are the possible signs and symptoms which you will see in a child if the child is in pain. So this pain may be before surgery, or it may be after surgery. And what is the desired outcome? The client will express feelings of comfort and reduce pain, and described by using a pain scale. See, there is a Wong-Baker's pain scale. Okay, so in which phases are given. So depending on that phase you can identify, and you have a scale for 0 to 10, that is no pain to severe pain. Depending on that you can use a pain scale to identify. Okay, so these are the desired outcomes. Now what are the nursing intervention and what is its rationale? First is assess sensation pain and non-verbal signs of pain such as crying. We have seen all the signs and symptoms. If the child has already undergone surgery, then you assess the incision pain. Okay, and the child may be crying, may be lethargic. There will be facial grimace depending on the intensity of pain. Okay, Why are we assessing this? Determines the need for initiation of analgesic therapy. Okay, so we have a WHO ladder approach for pain management. Okay, so depending on that we give it. So which medicine is to be given? Unless and until you assess pain, we will not be in a position to manage the pain. So first is we assess pain. Second is we administer analgesic appropriate for the severity of pain and age. Okay, pediatric medicines, it is usually calculated on per kg of body weight, so that is why age is very important. And second is we have to first is we have to assess the severity, second is depending on the age. Okay, so this allays pain and discomfort caused by its incision. So why are we are interested to give analgesic? And because this reduces the pain and discomfort. Okay, next is maintain position of comfort. So in whichever position the child feels comfortable, we have to give. And why are we interested to do so? Because it facilitates comforts and decreases pain caused by strain on incision. Okay, so in whichever position, it is usually the supine position, the child can keep the leg flexed also. Okay, this will not cause a strain on the incision. Okay, next is apply an ice compress on the scrotal area if hydrocele is corrected, and apply scrotal support is appropriate. If you remember my first class in which I discussed about inguinal hernia, उसमें हमने क्या पढ़ा था? In the last part of pathophysiology, if fluid is collected, okay, if the fluid is collected, it is called as hydrocele. If some organ is there, it is hernia, or you can even have combinations also. Okay, so in such cases, if hernia is repaired, so you can even have ice compress apply. We can have an ice compress on the scrotal area. Okay, so this ice, we know that it decreases the swelling. Okay, next is provide support to the buttocks during lifting and position changes. Okay, so please we have to support the buttocks. So why are we doing so? So this avoids strain and pull on the incision site. Okay, so this is nursing intervention. And list continues. Then encourage the parents to change diapers frequently. Okay, and why should we do so? Because this prevents irritation and pain at the incision area caused by wet diapers. If you have seen wet diapers are quite heavy as compared to dry diapers. Dry diapers are very lightweight, but as soon as it becomes wet, it becomes very heavy. So this heavy may cause pain because of the weight of the wet diapers, and this also creates irritation. Okay, next is provide toys and games for quiet play. See, because it is a surgical patient, we cannot allow the child to run about. Okay, so we have to provide toys and games depending on the age. Okay, so this facilitates diversionary activity to detract from pain. Okay, so we know that whenever we have pain, some sort of distraction will help us to reduce pain. Next is instruct patients to hold the infant during feeding, and when irritable, frequently burp to remove the swallowed air. Okay, so we have to instruct the patient to hold the infant during feeding. Okay, so this when we hold the infant during feeding, so this will reduce the strain on the incision, and the child feels comfortable because the mother is holding while feeding. Okay, and next is what is burping? Burping is see, when the child is taking feed, especially sucking. Okay, so there are chances that some amount of air also can go inside the abdomen. Okay, so if there is more air collected in the abdomen, so this will cause strain in the incision site. So that is why we are frequently burping, so that the swallowed air is removed. Okay, next is educate parents on the causes of pain and interventions needed to relieve it. Okay, so we have to involve the parents in the pain. We have to explain them why pain is there and what are the interventions available. क्या medicines है, क्या positions, all these things need to be told. So this helps them to proper understanding of treatment for pain post-operatively. So when we learn about pre-operative and post-operative care, what is always recommended is, suppose if you are planning any surgery, we have to tell them about the importance and what to expect in the post-operative period and what can they do. So, and if you do so in the pre-operative period itself, then it is quite easier for you to manage, because the parents will be understanding all these things. Okay, Now is we have completed acute pain, and next is deficient knowledge. Okay, and next aspect is nursing care for deficient knowledge. So absence or deficiency of cognitive information related to specific topic. See, hernia is not a very common problem. It is only it occurs in few people. So naturally, the layman will not be knowing all these things. Okay. So there is likelihood that there may be deficient knowledge, absence or deficiency of cognitive information related to specific topic. Okay, so may be related to lack of knowledge about post-operative care, because this may be the first time somebody is undergoing an operation. That too, operation in children creates it's a big stress on the parents. Okay, so how do you know? It is possibly evidenced by request for information about activity allowed. Okay, if you have worked in the surgical ward, you will be able to understand this better, because as soon as the child is brought from the surgery, or if you have come across patients who have been brought from the surgery, their family members will come. हम हिला सकते हैं क्या, बिठा सकते हैं क्या, ये कर सकते हैं क्या. So they are always interested to know कि what is the extent of activity which is allowed, and they are interested to know about wound care, dressing रोज होगा नहीं होगा, कब होगा, regarding diet, at what time they can give and what type of diet, and regarding bathing and comfort measures. So these are the different information, and depending on all this, you come to know that there has some deficiency in knowledge. And what is the desired outcome? Parents will obtain knowledge about post-operative, about all aspects. Okay. Now, what is the nursing intervention? Assess parents' knowledge of hernia, including its causes, surgical management, and assess the parents' willingness and interest to execute treatment regimen. Okay. So first is you have to tell, we have to assess knowledge means you have to ask आपको कितना पता है. Okay, कैसे हुआ, all these things you ask from the patient, and whatever the parents are lacking, you can build upon it. Okay. फिर दूसरा है कि you have to assess parents' willingness and interest to execute treatment regimen. Some parents will be willing to involve, some parents will not be willing. So that is why we need to assess patients' willingness, parents' willingness and interest to execute treatment regimen. Okay. So what is the rationale? Promote sufficient plan of instruction to ensure compliance. Okay. So compliance का क्या मतलब है? जो हम बोल रहे हैं वो लोग follow कर रहे हैं. That is called as compliance. Okay. So if you do this, तो क्या होगा? Parents will be able to comply. Okay. Whatever you are telling. Next is provide parents and child as appropriate with clear and precise information in understandable language, utilizing teaching aids and encourage questions. Okay. I have shown you photographs of inguinal hernia also. This can occur in after the newborn period also, when the child is maybe okay. So what happens here is, if the child we have to provide the parents as well as the child as appropriate with clear and precise information in understandable language. If the parents can understand only Hindi, तो हिंदी में आप बात करिए, and it has to be clear and precise. ठीक है, क्या आप बात कर रहे हैं, you have to be very clear, आप क्या बताना चाह रहे हैं, and precise information. Precise is whatever it is needed, that has to be told. Okay, and you can even use teaching aids to do that. Okay, for example, for teaching this topic, I have used some AV aids, so that once you see the picture of inguinal hernia, you will be able to understand. So parents also requires, and child, if he can do so, he requires some pictures. Okay, or teaching aids, whatever is available, and encourage questions. Okay, encourage. And why are we encouraging questions? So that you can be clear whether they have understood or not. Okay, so ascertain understanding based on age and learning ability. Depending on that, you have to check whether whatever you are trying to tell, they have understood or not. Okay. Next is encourage patients to hold patient when the crying or feeding. Instruct the child to avoid pushing, lifting, or engaging in vigorous activity of gym classes. This can even occur in adolescent children also. Okay. So if it is a newborn baby, encourage the parents to hold the infant by his crying and when it is feeding. Okay. Crying can occur during pain also. We have already studied. Okay. And instruct the child to avoid pushing, lifting, or engaging in any vigorous activity. Okay, so this prevents strain on the incision and possible hernia reoccurrence. We don't want hernia to reoccur. So this is major pushing, lifting, and vigorous activity has to be avoided in the immediate post-operative period. Okay, next is instruct in doing sponge bath till the incision heals. We don't want अपने सर्जिकल वार्ड में देखा होगा, once the surgery is over, till the stitches are removed, we don't send the patient for a bathroom bath. It has to be sponge bath. And why are we interested to do so? ताकि गंदा पानी incision site में नहीं गिरना चाहिए. Okay, so this maintains the integrity of the incision. अगर ऐसा नहीं करे तो क्या होगा? Stitches खुल जाएगा. So main is we want to maintain the integrity of incision. Now is inform to keep incision dressing until it peels off and then apply diaper so that it does not cover the incision. Okay, in newborn what happens is, suppose in case of infant, we have to see, if you remember our previous slide, absorbable stitches are used. Okay, so this incision dressing will peel off. Okay, so unless incision dressing is peeled off, okay, this a diaper should not cover the incision. Okay, so suppose if the child is operated today, the child may be called on 6th or 8th day, then we remove the adhesive and check whether everything is okay or not. So till it is done, so the diaper should not cover. आपने ward में देखा होगा diaper, this is usually of a large size. Okay, so should not cover the incision. This maintains the dry and clean incision site. Encourage the parents to increase fluid intake and protein rich diet as ordered. Why? Because promotes return to nutritional status without causing gastrointestinal strain on the incision. Okay, fluid लेना है. Okay, and protein rich diet has to be there because once the child is taking nutrition properly, nutritional status will be normal as early as possible and GI strain will not be there. The child will not, if the fluid intake is not so good, so what happens is the child may be straining its stool and this can be harmful for the child. Okay, then reassure parents that infant normally tolerates surgery well and recovers without incident, and that this condition is one of the most ugly surgeries in most usual surgeries in the infancy. Okay, so you have to reassure the parents ki normally the child will be all right. Okay, so if the child tolerates surgery well usually, okay, and recovers without any problem, and hernia is one of the most common surgery which we do in children. Okay, so this provides assurance and comfort to the parents in giving care. Once the parents come to know it is a very normal surgery. Normal surgery means very not normal. I will use the word common. It is a very common surgery which has been taking place. So this will provide assurance and comfort to the parents in giving care. Okay. Now we'll come to the third aspect, that is risk for injury. Okay. So we have completed acute pain. Second is deficient knowledge. Now we are coming for risk for injury. Okay. Vulnerable for injury as a result of environmental conditions interacting with the individual's adaptive and defensive resources which may comprise health. Okay, so the child may be vulnerable, there may be risks for injury, okay, depending on the environmental conditions and depend on how the child or the parents is interacting. Okay, so this may be related to intestinal obstruction. Okay, that time we have already discussed. If you have a loop of intestine in the hernia, so this may get twisted. Okay, this may get twisted, this may get edematous. Okay, and this will cause intestinal obstruction. Okay, so there may be risk of injury to that, and sinus from possibly evidenced by is not applicable, and desired outcomes will, the child will not experience any injury. Okay. Now what are the nursing interventions? Okay, assess by palpation for any swelling in the umbilical or inguinal hernia while the child cries or when the child strains or coughs, and ability to diminish swelling with gentle compression if the bowel is forced into the sac. Okay, how to assess the risk for injury? First is you have to assess by palpation. If it is an umbilical hernia or if it is an inguinal hernia, when the child is crying or when the child is straining or coughing, there are chances that this hernia would be protruded, ठीक है, बाहर आ जाएगा. And we also have to assess the ability to diminish swelling with gentle compression of bowel forced into the sac. Okay, तो हमको assess करना है, ठीक है. When the child cries, हमने पढ़ा था कि whenever the child is crying or coughing, there may be bulging जहाँ पर hernia है, ठीक है. और umbilical hernia को थोड़ा प्रेस करने से it goes inside. Okay, so we have to whether is it able or not, we have to check it. Okay, what is the rationale? Shows hernia that is reducible, easily manipulated back into the place. So by doing so, we can demonstrate that this umbilical hernia or inguinal hernia can go back to the place. That is called as reducible. Okay. Next is assess hernia site for any tenderness. Okay, or any other symptoms such as increased abdominal girth, loss of appetite, irritability, there is defecation changes. All these things has to be assessed. So this will indicate whether some twisting is there, whether any other issues are there, so that can be found out. Okay, so this reveals partial or complete obstruction as a result of incarceration and strangulation. Okay, so once you assess the hernia site for sign and symptoms, we also assess whether is it a partial obstruction or it is a complete obstruction. Okay, next is encourage parents to hold and feed the infants while hungry to prevent the infant from crying. Okay, so feed the anticipate कि हाँ भाई इतना देर हो गया, feed दे देना चाहिए, ठीक है. So that is called as anticipatory feeding. So because what do infants do? जब भी भूख लगा तो लोग होंगे. We should not wait for the child to cry and then you give the food. Rather anticipate करना है. Anticipate मतलब अभी भूख लग रहा होगा, ये सोचना है और खिलाना है. Okay, so and once the child is crying, this will again cross bulging. So crying issues should not occur. Okay, avoids bowel from being forced into the sac. Okay, so when the child is crying, there are chances that this will be more prominent and more causes of problem. So this can be reduced. Okay. Next is instruct parents to notify sign and symptoms to physician, inform of reason for disorder, expect effect and those that signify any obstruction. Okay, we have to be vigilant for the sign and symptoms. Okay, whether the child is we have already studied the sign and symptoms of strangulated hernia. So whether those sign and symptoms are there, we need to find out and then it has to be informed. Okay, so prevents more severe complications of eventual gangrene of bowel. Okay, so the earlier the surgery, the faster the recovery and the chances of complications are less. But if it is the reverse, that is the child is taken to the surgery very late. Okay, so this will prevent more severe. If you do so, this prevents more severe complications of eventual gangrene of bowel. Okay, so whenever whichever part is strangulated, if you don't manage, the result is eventual gangrene. So this can be prevented by having a proper assessment and then instruct the patients to notify sign कब आना है, this has to be told. Okay. Next is counsel patients regarding dietary inclusions and restrictions to avoid straining. Okay, so we need to modify the diet to prevent constipation. Roughage has to be decreased straining and increased intra-abdominal pressure that forces bowel into the sac. Okay, so for dietary advice we have to ask them to modify the diet so that constipation can be prevented. What can you do? So roughage increase करना है, ठीक है. Fluid intake has to be increased, ठीक है. So this will decrease straining and increase abdominal pressure which forces the bowel into the sac. See, once you strain during stool, the problem क्या होगा? Intestine will be more forced into the sac, ठीक है. So this has to be reduced. Next is teach parents of surgical procedure to repair hernia and possible hydrocele and course of progress to expect. Okay, तो ये हमको बताना पड़ेगा भाई ये प्रॉब्लम का एक ही इलाज है, दैट इज सर्जरी, एंड डू इट as fast as possible. Okay, and if hernia is there, hydrocele is there, that also has to be corrected. Okay, then corrects and repairs hernia and hydrocele if present before the development of complications. ठीक है, हम लोग एडिमा होके फिर स्ट्रैंगुलेट होके, वी डोंट वांट ऑल दोज थिंग्स, इसलिए पहले से ही सर्जरी कर देने से दोज इश्यूज कैन बी प्रिवेंटेड. ओके, so reassure parents that hernia usually resolves itself and if not surgery may be expected to repair. हमने उस दिन पढ़ा था that umbilical hernia का 50% अपने आप ठीक हो जाता है, but that is only in mild cases. Okay, अगर ऐसा हो गया तो अच्छी बात है. ठीक है, then what is the side rationale provides information regarding prognosis of the disorder. Okay, next is last is risk for fluid volume deficit. Okay, at risk for expressing vascular, cellular or intracellular dehydration. Okay, this may be due to post-operative, we keep the patient nil orally, so that's why there may be some post-operative issues, or this may be a case of this may be related to dehydration. Okay, so there is a risk for fluid volume deficit. Okay, so this deficit can be vascular, cellular or intracellular dehydration. Okay, and why this will take place? Because of the child has to be kept nil orally. Okay, so that is why, and then the child may be dehydrated, and this is evidenced by signs and symptoms of dehydration, which you already know. There can be dye skin, there can be less urine output, there can be sunken eyes, depressed fontanelle. Okay, all these things are the signs and symptoms. And what is the desired outcome? Client will experience adequate fluid volume. Okay, so this is the desired outcome. Now, what are the nursing interventions? Assess onset of nausea and vomiting, quality, quantity and presence of blood, bile, food and odor. Okay, so if the child is having nausea and if the child is having vomiting, if it is vomiting, then we have to see the quantity, we have to see the quality, we have to see whether bile is present, whether food is there, what are the contents of the vomitus, that has to be told. This provides information about emesis and defining characteristics. Then you have to assess the skin turner, mucous membrane, fontanelles. Okay, last void, what are behavioral changes, all these things we need to assess. Okay, so this provides information about hydration status, including extracellular fluid losses, decreased activity level, malaise, weight loss, poor skin turner, concentrated urine. Okay, so this information has to be given. Okay, that is why based on this we assess the skin turner. Okay, we have to assess the signs and symptoms of dehydration. Okay, we have to also see the skin, the mucous membrane, we have to check the weight, we have to check the fontanelle, especially anterior fontanelle, because anterior fontanelle will be depressed in cases of dehydration. Okay, next is assess the vital signs including the apical pulse. Okay, so provides monitoring of cardiovascular response to dehydration. There will be weak thready pulse, there will be drop in BP, so this all has to be included. Okay, so provides monitoring of cardiovascular response to dehydration, weak thready pulse, drop in blood pressure, increased respiratory rate may contribute to fluid loss. If the respiratory rate is increased, what happens is the more the child has increased respiratory rate, more will be the dehydration. Okay, next is monitor unique specific gravity, odor and amount every voiding or as ordered. Okay, the urine output has to be recorded. Okay, so concentrated urine with an increased specific gravity indicates lack of fluids to dilate urine. Okay, so if it is a concentrated urine and if the specific gravity is more, so this is usually occurring if there is lack of fluids to dilute the urine. Okay, next is we have to monitor lab data, electrolytes, blood urea, nitrogen, CBC, pH, etc. This identifies the fluid losses and electrolyte imbalances. Okay, so that is why we need to monitor all this. Next is maintain NPO status if prescribed. Nil orally, the child has to be kept nil orally if required. Provides rest to the GI tract because of nausea, vomiting and associated medical conditions. We have studied that the child may be having nausea, may be vomiting, and if the child takes feed, then the problem is going to be increased. Okay. So next is position a child on one side and sitting up when vomiting. Keep suction available. Okay. So if the child is small, you can keep it in the side of this, or if the child is able to sit, the child will be sitting up. Okay. So this, if we do so this provides, as this avoids aspiration of emesis. Okay. We don't want the child to aspirate whatever he has vomited, so that is why the child can be on a side-lying position, or the child can even sit. Okay. Next is administer antiemetics as ordered. If the child is having vomiting, then you have to give antiemetics given as a prophylaxis and treatment to post-operative nausea and vomiting. Okay. So we know that if the child is having nausea and vomiting, the chance we have to give antiemetics. Okay, we have to give antiemetics and all those medicines which are ordered for diarrhea. Okay. Next is initiate and monitor IV administration of nutrients as prescribed. If some nutrients is prescribed, that has to be initiated. Okay. Provides, and why do we give? Provides fluid and nutritional support to replace active fluid loss and prevention of fluid overload. Okay. So if required, we can initiate and monitor the IV administration so that our fluid loss can be decreased. Okay. Then initiate small amount of clear fluids as tolerated when nausea and vomiting subside. Offer oral hydration fluids. Breastfed babies need more frequent short feedings at the breast. Okay. So what do we do? Initiate with clear fluids. Okay. And if the child is able to tolerate, then we have to give breastfeeding. Okay. Then the oral care. Okay. So offer oral hydration fluids. If the child is able to do so, then we have to offer oral hydration fluids. Then breastfed babies require frequent short feedings at the breast. Okay. And provides fluids in minimal amounts until the nausea and vomiting is resolved. Okay. So till the vomiting is resolved, this is what we have to do. Okay. We give small amounts of clear fluids so that the child does not vomit. Okay. Next is instruct parents regarding causes of nausea and vomiting, signs of dehydration, and when to depart, when to report them to the physician. Okay. We have to instruct the patient regarding causes of nausea and vomiting. Okay. What are the signs of dehydration, and when the child is to be brought for checkup. So this all has to be taught to the parents, and provide information for immediate treatment of excessive loss of fluid and electrolytes caused by nausea and vomiting. Okay. So this is what is to be done. Now what are the complications of hernia? Irreducibility, that is if the hernia is there, I was telling what umbilical hernia press करने से नीचे नहीं जा रहा, that is called as irreducibility. There can be obstruction, there can be strangulation, there can be inflammation, and there can be incarceration. Okay. Incarceration. Okay. So these are the different complications of hernia. Okay. So that was all about today's topic. So today we have discussed nursing care plan of inguinal hernia, which had basic four problems. Okay. We started with acute pain. Okay. So acute pain can occur before surgery, can be after surgery. So there will be specific signs and symptoms, and these are the desired outcome. Okay. Next is we have studied what are the nursing intervention. Similarly, we studied for the deficient knowledge. Okay. Next is we also studied about the risk for injury. Okay. Third was risk for injury. We have studied. Next is there is risk for fluid volume deficit because the child is having nausea and vomiting. Okay, so we have already discussed the signs and symptoms. So depending on the signs and symptoms, we need to manage. Okay, so that was all about today's topic. Then we ended with complications of hernia. So I fully believe that all hernia 1, 2 and 3 is clear to you. If you have any doubts, you can easily ask. Second is, I would also like to take a test on hernia. Okay, so I will let you know later when will be the test, and prepare well for hernia. Best of luck. Thanks.